So good evening, my dear doctors. Welcome in the Diagram Friday once again. So every Friday we are discussing diagram in only 10 minutes. So today I will be discussing a simple diagram from immunity chapter. It's a wonderful diagram from Ganong mainly because this is the standard book. But I can vouch you that whatever may be the question in your exam regarding immunity, whatever may be the question, you can draw this diagram and this is helping you in the short note, in the long question also, as well as MCQ. So this diagram is the center theme of immunity chapter. Okay. So whenever any antigen comes to your body, whenever any antigen comes to your body, there are antigen presenting cells who will catch those antigen and present to T lymphocytes. You know that? So whenever any antigen is there, for example, I'm having sore throat. So there might be some antigen in the bacteria in my throat. So they might be having some antigen. So that antigen will be presented by antigen presenting cell. That will be presented by simply antigen presenting cell, APC. And antigen presenting cells are so many. One of them are macrophage. So in this diagram, you can see macrophage are antigen presenting cell. They are simply macrophage, or you can say antigen presenting cell, because they have to present antigen to the T lymphocytes. Is this clear? Is clear? This diagram is clear? Okay. So macrophages are going to present antigen to whom? T lymphocyte. So T lymphocytes are having T cell receptor, TCR. So first of all, antigen presenting cell macrophage will catch hold of this antigen and will go to whom? To T lymphocyte. And how it will recognize T lymphocyte? Number one, by MSC class 2. MSC class 2 are like molecular signature. What is MSC class 2? MSC class 2 are simply like molecular signature. Okay. So every cell in your body is having your signature. Okay. So any foreign body coming to your inside your body will have its own signature. That is why how you shall know that this is our own cell or a foreign body? It is your MSC. Okay, it is a MSC. So MSC class 2 will come to this T lymphocyte presenting the antigen. You can see here, these are the antigen, and this is MSC class 2. MSC class 2 is the molecular signature which will be recognized by CD4. Remember, MSC class 1 recognized by CD8 and MSC class 2 recognized by CD4. CD4. Is this clear? So T lymphocyte, how it will recognize that this is my antigen for which I am designed? Answer is T cell receptor, TCR, T cell receptor, TCR. So TCR will recognize the antigen and CD4 will recognize what? That this T lymphocyte is for this antigen and is carrying by whom? Antigen presenting cell. And who is antigen presenting cell, dear doctor? It is here it is macrophage. Macrophages are recognized by CD4. Is this clear? Now they will talk to each other. Who will talk? These macrophages will talk to T lymphocyte. When I am talking in the form of sound. But these macrophages are talking in the form of chemical. What is that chemical, doctor? Answer is Answer is interleukin 1. You can see here interleukin 1. Can you see interleukin 1? Can you see this interleukin 1? Yes. This interleukin 1 is chemical by which your macrophage is talking to T lymphocyte. They have to talk to each other, na? Only then they will be in relationship. So this relationship between macrophage and T lymphocyte is built by chemical called as interleukin 1. Now, interleukin 1 will activate your T lymphocyte. Now, which interleukin will be secreted by T lymphocyte? Answer is interleukin 2. Interleukin 2. You will get full marks if you can draw this diagram in the chapter of immunity. It is the most important central theme. So, macrophages are secreting what? Interleukin 1 and activating home T lymphocyte. It is called as paracrine stimulation. What is it called as? It is called as para. It is called as paracrine stimulation. It's called as paracrine stimulation. But T lymphocytes are releasing interleukin 2 and they are activating their own cell. And this interleukin 2 is activating its own cell. So this is called as autocrine stimulation. This is called as autocrine stimulation. Are you getting my point? First antigen will be catch hold by antigen presenting cell and here it is macrophage. Now macrophage will have a molecular signature called as CD4. CD4 is recognized by whom? CD4 is sorry. CD4 is recognized by your MSC2. Just a minute. Yes, sorry. It is recognized by MSC2. Now it's clear. By MSC2. CD4 by MSC2, interleukin 1 will activate your T lymphocyte. Interleukin 2 will activate its own cell and that is called as autocrine. If I am stimulating you, if I am activating you, it is paracrine. If I am motivating myself that I have to wake up early in the morning, I have to go to gym or whatever, what is that? Autocrine stimulation. So always remember this is one of the most important point. T lymphocytes by releasing interleukin 1 causes paracrine stimulation. On the other hand, T lymphocyte macrophages are releasing what interleukin 1, but T lymphocyte macrophages are releasing interleukin 1, not 2. And T lymphocytes are releasing interleukin 2. But this is autocrine, this is paracrine. Now, after this struggle, your T lymphocytes are activated. This is called as activated T cell. This is called as activated T cell. This is how T lymphocytes are activated. This is how T lymphocytes are activated and they can convert into cytotoxic T cell to cause cell death. So that antigen will be killed, murdered by T lymphocyte. Which lymphocyte, doctor? Cytotoxic T cell will cause cell death of antigen. Can you understand this beautiful mechanism of immunity? Whenever T lymphocytes are activated by macrophage, they will cause cell death. They will cause cell death by forming cytotoxic T lymphocyte. And on the other hand, they cannot form antibody. Antibodies are formed by B cell. So they will also activate B lymphocyte so that they can form antibody producing cell, plasma cell, and these antibodies will again cause cell death. So when T lymphocytes were causing cell death, that is called as cellular immunity. It's called as cellular immunity. Are you getting me? And this is called as antibody induced humoral immunity. Am I clear? So one diagram is telling you about cellular immunity, about humoral immunity, about antigen presentation, about autocrine stimulation, about paracrine. But let me summarize the summary. Whenever there is any antigen in your body, it will be catch hold by antigen presenting cell macrophage. And macrophages are having MSC class 2 protein. It is a molecular signature because T lymphocyte will not act if molecular signature is different. So T lymphocyte will act because CD4 will recognize MSC class 2, and now macrophage will start communicating to whom? To T lymphocyte. By which chemical? Chemical communication. Answer is interleukin 1. Answer is interleukin 1. Now, your T lymphocytes will be activated enough by paracrine stimulation. They will also release interleukin 2 and they will activate themselves. And what is that called as, my dear doctor? That is called as autocrine stimulation. This is how T lymphocytes are stimulated and they can convert into cytotoxic T cell and kill the antigen, or they can activate B lymphocyte to form antibody producing cell, plasma cell, and antibodies will again damage antigen. So this is your cellular immunity and humoral immunity. Is this clear? So if you have Gano, you can open the book and please read. And I am pretty sure that every concept will be clear. This is it. This is a summary of your innate, humoral and cellular immunity. Rest all are the peripheral detailings and all. Okay. Once you know the main point, the summary, you can correlate everything. So once you start making this diagram, drawing this diagram, the flow chart, okay, and then you start correlating other things as well. So I think this is it for today. I will not exceed your time. I know your time is crucial. So just to maintain the curiosity, I will not exceed the time. I know the span is not more than 10 minutes nowadays. So every Friday and Monday, I'll be taking just ultra short session on physiology. Okay. So all the best. Meet you next Monday and then Friday.